Hey everyone, it's Eric Pook, Managing Director here at Cirrus Consulting Group. The question today is specifically about what to expect when requesting a complimentary lease review or a critical dates and risk analysis. So we get this question all the time, first and foremost, especially amongst the uncertainty going on right now with COVID-19 and with the many layoffs going on throughout the continent. The lease has now become the #1 expense to the dental practice, including the rent as well as all the additional rents, including taxes, maintenance, and insurance. So we've had more requests for lease reviews in the past 3 weeks than we have in our entire 26-year history. So I thought this would be a little helpful for everyone to understand what they're requesting and the value behind it. So first and foremost, what we do is we pull up all the specific real estate reports for your region. We have an incredible amount of, let it be other leases we've negotiated in the area, as well as all the proprietary real estate reports that can give us a great estimate in terms of the rental rates, vacancy rates. We can see some basic demographics. For a good portion of the continent, we have all that information to help review to ensure that we're paying fair and equitable market rents. So if you've ever have a lingered thought or question about, am I paying fair rent today? This is definitely very important to ensure that your financials and your commitments are aligned with market price. So that's #1. #2 is, and arguably most important, is understanding what is in your lease agreement and what are some of the $100,000 traps that are in your lease agreement. So for those of you that have attended the recent webinars, you were able to see the dozens and dozens of clauses that could have a significant impact to the survival and ability to help your practice thrive as we get through this global pandemic. So we'll go through and spend an hour or so going through your lease agreement in preparation of the call to help identify some of those major components, such as, does your landlord have the right to require you to return it to pre-dental condition upon the surrender of the premises and giving back the keys to the landlord? We would also look through specifically the default section, right, to determine if, heaven forbid, you missed a lease payment or were held in default for not being continuously open. What is your requirement and what happens then? How much control does the landlord have? Do they have, for example, the ability to terminate your lease for being in default? Is there a cure period? Those are some of the major things we'll touch on, as well as the assignment and subletting section, which dictates if and how you can sell your practice, where we'll look at how much control the landlord has when you are looking to assign your lease in conjunction with the sale of your practice. Also, a lot of doctors are usually blown away at the fact that even after they've sold their practice, they're continually and also personally liable. In terms of even after they've sold, they're still responsible for the lease agreement, as well as determining the amount of personal risk you may have through the personal guarantee section. So those are just a small handful of some of the many and many clauses that we will review as a part of the complimentary lease review that we've structured for all those who have attended the course or all clients of Henry Schein. So we appreciate your time and looking forward to getting an email to info@cirrusconsultinggroup.com or reaching out to us directly, and we'll be able to certainly circle back with you. In the link, there'll be a section for our direct contact information, 866-739-9075, extension 0, and we'll be able to schedule that call for you. Thank you very much for everybody's time. My name is Eric Pook, Managing Director at Cirrus Consulting Group. Thank you very much.